Hey everyone. So today we wanted to talk to you about how we view the behavior of muscular tissues and how this can help guide our assessment and our rehabilitation approach. And the reason we think it's important to step back and consider how we view the behavior of muscular tissues is because muscles are extremely complex. Okay. And during real world movement behaviors, they don't really operate, with very clear actions and behaviors like we learned in school. And neurological research, they really in the past have pushed this idea that we really have more muscles than we seemingly need. Okay, but more recently there's a bigger push to help us understand that having multiple muscles with similar behaviors actually gives our system much more options to help to distribute forces and to spread and share forces across the anatomy. It gives our system a bigger safety net, or it gives our system more backup. It gives our movement system as a whole more backup systems to help manage forces. Okay. Now, with that understanding, it's helpful to have multiple muscles with similar behaviors, but at the same time, because they're so complex, we can't really guide our assessment and rehabilitation around isolated muscle behavior. And many systems will do that. They look at one muscle or try to identify what muscle's tight, what muscle's weak, and then organize their rehab around that. But we really can't do that when we consider the complexity of muscular behavior across the anatomy. Okay. So within a neuromechanical approach, a really important distinction when trying to wrap your head around anatomical behavior is using a top-down and bottom-up viewpoint or lens to understand the behavior of the anatomy. Okay, and a top-down approach really represents how the central nervous system is directly influencing the anatomy from the top down. Okay, primarily through motor output or the generation of muscle activity. Okay, but based on the quality of the sensory feedback. Okay, so a top-down approach requires high-quality sensory feedback from the anatomy and for the nervous system to process that information and then generate a motor response in response to the sensory feedback. But through a bottom-up approach, this is really looking at how the anatomy or the mechanical design or architectural design of the anatomy and body as a whole is organized and set up to help assist the anatomy in managing forces and distributing forces that act on our system from the external environment, how we manage those perturbations acting on our anatomy from the external environment. But the key with the bottom-up approach is understanding how the anatomy handles those forces and perturbations without excessive intervention from the top-down central nervous system. There's always going to be some influence from the top down. There has to be to generate muscle activity. But it's about making sure the central nervous system isn't micromanaging the anatomy through muscle length changes and joint angle changes. Okay. So what you can see here with the top-down approach, the focus is on the quality excuse me, is on the quality of the proprioceptive feedback, the sensory information, because ultimately the brain lives in a very dark cave. It has no access to the anatomy, to the external environment. It needs sensory information to generate what many papers call an internal model or an internal representation of our anatomy. Okay, so for example, let's say you have an injury in a specific area, and we'll talk about the ankle in a few minutes, but with an injury in a certain area, that's likely going to disrupt the quality of the sensory information from that area to the nervous system. Okay, and that's going to have an influence then on the nervous system's internal map or internal representation of that local area, and that's going to further have an influence on how the nervous system knows how much muscle activity to express to coordinate the movement around that certain area. So again, it requires high quality sensory feedback to deliver or generate appropriate muscle activity. Okay. But here's where it changes. Okay. And what we need to consider essentially is what happens during real world movement. Okay. Because during real world movements, we're not moving single joints. We're not moving isolated muscles. We're moving many joints simultaneously. And we're managing forces and distributing forces across many muscles at the same time as well. And on top of that, we're also moving in very unpredictable environments where there's lots of forces and perturbations acting on our anatomy simultaneously. Okay. And with that consideration, there's two key constraints that we need to consider. Number one is that the central nervous system doesn't have the capacity to consciously control all the muscle, all the muscles and all the joints simultaneously. Okay, particularly when we're moving multiple joints and multiple muscles simultaneously. Okay, it just doesn't have the capacity to do that. Excuse me. Number two, and much more importantly, is that there are inherent delays in the sensory motor system, meaning that there's a delay in the speed at which sensory information can travel to the nervous system, to the central nervous system, and for that information to be processed and for a motor response to be generated. So let's imagine you step off a curb and you land awkwardly, and your foot's kind of traveling into the pressure is traveling towards the outside of the foot. You're about to roll over your ankle. Okay, in that situation, if we had to wait for sensory information from the muscle stretch, from the joint angle change to travel back to the spinal cord and the higher parts of the central nervous system to be processed, and then for a motor response to be delivered to the ankle muscles to maintain position or prevent excessive movement, by the time that sensory information goes back and forth from the nervous system, it's too late to manage those forces. Okay, particularly when it has to travel up to the higher parts of the central nervous system. Okay, so what we do have in across our movement system is we have features that enable our anatomy to have much faster responses, much quicker responses to manage these forces, manage these perturbations. And while those features or the responses from those features might not necessarily be enough to manage those forces on their own, what they do is they buy our system time to be able to allow for time for top-down muscle activity to make the necessary changes then if they need to be. Okay, and these features are a combination of preflexive features along with the mechanics of the anatomy, the mechanical design of the anatomy. So, for example, if you look at the muscular tissues around your ankle and your foot, particularly the plantar flexors, okay, the plantar flexors are very short-fibered muscles, okay, and a muscle that's very short-fibered can react much faster to perturbations, okay, versus a muscle with a much longer fiber, like the glute max, for example, okay. And when you pair a short fibered muscle with a background level of muscle activity that we always have present in tissues, there's always a kind of a background level of muscle activity or driven through feed forward neurological control that's present in tissues to allow for forces to be managed quickly. When you pair that feed forward muscle activity or background muscle activity with those types of muscular, with that kind of muscular design, then you have a region that can quickly respond to forces. So if you look at a muscle like a glute max, for example, with long muscle fibers, if you put that glute max in the back of the shin, it's not going to be able to pair well with that background level of muscle activity to respond very quickly. So it's about the understanding of how the nervous system and the actual mechanical design of the anatomy interacts to be able to manage those forces quickly. Okay. And again, the anatomy is designed this way to allow for this to occur. Okay. So essentially we have two lenses through which we can view muscle behavior. Okay. Firstly, we can look at the proprioceptive feedback, the sensory feedback from a particular muscle to give the central nervous system a more rich internal representation or internal map of the anatomy. Secondly, we can look at the intrinsic mechanical design properties of that muscle and how that might influence how well they can manage forces, how quickly they can manage forces. Okay, because as you can see with the plantar flexors versus the glute max, for example, we step back and we understand, okay, the distal and proximal tissues, muscular tissues of their anatomy have these inherent features. There has to be a reason for that. Okay, so if we look at a quick case example here, let's say we have a client 2 weeks post lateral ankle sprain, okay, that just came to see us in clinic, and excuse me, and they were just resting the ankle for those 2 weeks. In that time frame, the nervous system likely wasn't receiving quality proprioceptive feedback from those tissues around the ankle. And so what we want to do early on is improve the contractile variability of those muscles, okay, which means improving how those muscular tissues move and manage forces with those three key contractile behaviors: concentric, isometric, and eccentric, okay? And that will work to restore that rich internal map of the nervous system, because the nervous system is getting different sensory feedback from those different muscular behaviors as a result, okay? And of course, we'll need to couple that with the unique limitations of the client as well. So instead of thinking about it from, you know, a region-specific standpoint around the ankle, think about the contractile variability. Is the nervous system getting feedback about how the muscles are managing forces through those three key muscular contractile behaviors? Okay, now that would be looking at things from a top-down perspective. But as we work towards progressing the client back to real world movements, we want to really challenge the isometric behavior of the plantar flexors at different speeds, under different loads, and at different joint angles. Okay. Because again, a key behavior to help quickly manage forces is the capacity of those distal tissues to operate isometrically. Okay. Based on the mechanical design. And what that also helps us to do is allows the Achilles tendon to contribute to the buffering forces, because the isometric behavior of the plantar flexors will allow for the Achilles tendon to lengthen and shorten and be able to distribute forces as well, which it can't do very well when the plantar flexors are working eccentrically and concentrically. Okay. But it also, again, that isometric behavior, the lengthening and shortening of the Achilles allows for the foot to express a little bit more adaptability as well. Okay. So two clear distinctions there. Top down is more restoring contractile variability. Bottom up is more about trying to challenge the inherent qualities of those muscular tissues based on the mechanical design of the anatomy and how well they help us manage forces. Okay. So, like I said, from this, it's very clear that more of a top-down approach may be needed early on during the rehab process, but more of a bottom-up approach might be needed more or need to be integrated later. But here's where it changes as well, is that there needs to be a distinction, especially when we are working with more chronic and persistent cases and musculoskeletal conditions, where oftentimes what you see, many times what you see is too much top-down control, where the nervous system is trying to micromanage our anatomy too much, and there's not enough capacity to shift that workload into the mechanical properties of the anatomy. Okay, so we'll chat more about that in future videos, but it's very, very important to understand, okay, how things might change in chronic, persistent cases versus acute cases like directly after a lateral ankle sprain. Okay, so again, a very simple distinction here between how muscles might behave when we look at them through a top-down and bottom-up lens. But hopefully from that you can see how it's an important distinction to make when we're working with clients experiencing pain and movement limitations. So thanks so much for listening if you made it all the way through, and we'll chat to you again soon.